Ultrasound scans during pregnancy are a way of determining your baby's growth and your baby's overall health. So there are 4 very common scans that are usually recommended during pregnancy. So in this video, let us discuss about these 4 scans. Hi, I am Saranya, the founder of Babypedia, a birth professional and a life coach for pregnant women. So the first scan is the early pregnancy scan. So this is usually done after the 6th to around the 8th or 9th week, primarily to detect the following. 1, the number of pregnancies. Are you pregnant with one baby or multiple babies? Whether you have an ectopic pregnancy, that is, where is the baby attached? Is it attached to the uterine wall or in the fallopian tubes? Because if it is attached to the fallopian tubes, this is called an ectopic pregnancy and is dangerous for the mother and the baby. Then it is also seen to know your due date and the weeks of gestation. That is how old your baby is and whether your baby is growing according to the weeks after fertilization from your last menstrual period. It is also needed to note whether your baby's heart is started beating or not and if it is normal. So that is why, and this is usually done using a transvaginal probe. So this is not an abdomen scan. The doctor will insert a scan probe into your vagina. So it is recommended that you relax using breathing techniques, visualization, whatever works for you. And they will do the scan because your baby is too small to be seen through the or using an abdominal scan. Now, the next scan is called the NT scan or the nuchal translucency scan. This can be done in combination with other early pregnancy blood tests. So it can be done between the 11th to the 14th week. So for what purpose is this NT scan done? They will check the back of the baby's head to measure the amount of fluid that is there. All babies will have fluid behind their neck, but if the fluid level is a little high, it could be an indication that your baby has genetic or chromosomal issues. So this test can help us get an idea whether your baby has a high risk of getting chromosomal issues like trisomy 21, that is Down syndrome, or trisomy 18 and trisomy 13. So in case your doctor feels like the amount of fluid is a little higher, they will ask you to go for further testing, and based on that, they will be able to tell you whether your baby has any chromosomal or genetic issues. If the amount of fluid is quite high, then there is a higher chance that your baby also has congenital heart problems. That is, there are issues with the formation of your baby's heart. So that is why it is recommended to go for the NT scan at 12 weeks. The next scan is usually around the 18th to the 21st week, that is called the Anamoly Scan. So this Anamoly Scan will check each and every part of your baby, like the facial features, their hands, the formation of their toes, their legs, and also whether all the organs are formed properly. It is usually seen to detect any formative defects that are there in your baby, and your doctor will also be checking the amount of amniotic fluid that is around your baby and also where the placenta is placed. Doctor will also be checking whether your baby's growth is corresponding to the weeks of your pregnancy to see if your baby is growing slowly or your baby is gaining too much of weight too fast. So these are some of the things that your doctor will be checking in the Anamoly scan. This will be an abdominal scan. So your doctor will ask you to lie down flat on your stomach for a few minutes and your doctor will do the scan. So there is a possibility that sometimes if you ask your doctor, some scan centers do provide 3D and 4D images of your baby during the 20th week. So it is always recommended that you ask your doctor beforehand and choose a scan center that will give you these 3D images of your baby if you would love to have it. The next scan is done between 28 to 32 weeks and is called the growth scan. So this growth scan again measures whether your baby is growing healthy according to the gestational age, and about your doctor will also be checking your baby's movements, how they're reacting to external stimuli. Your doctor is also checking the amount of amniotic fluid that is there, and if you have high water levels or low water levels, your doctor may recommend getting monitored intermittently after this. Your doctor is also checking whether the placenta is functioning well, whether the placenta is becoming too mature or is it right for the gestational age. Your doctor could also be checking if your cervix is in the right length and there is no issues with your cervix, that is, it doesn't become smaller also. And your doctor could also be checking to see if your baby's heart rate and the amount of blood they are getting through the umbilical cord is also good for the gestational age. Also, your doctor will be checking for your baby's weight and your baby's height to see whether they are growing according to the gestation age or the weeks of your pregnancy. So these are some of the scans that are very important during pregnancy. Now, based on these scans, if there are any complications, your doctor might recommend getting further scans. Like for example, if you have low or high amniotic fluid, your doctor may recommend getting scans more frequently even after 32 weeks to ensure that your water levels are not getting drastically low or is not too high. So based on these, your doctor may recommend further testing. I hope this video helped you and gave you a lot of clarity on the different types of scans that are recommended during pregnancy. Don't forget to like, share it with another pregnant mother or a pregnant family so that it can help them, and subscribe for more such information. Take care. This is Saranya.